An uncommon use of weight loss surgery, how a stabbing victim ended up as a bariatric patient. And a closer look at teens and their mental health in the Central Valley, advice for parents when it comes to signs of trouble. Plus, what these two young women now share that makes a bond between sisters even stronger. Hi there, I'm Julie Musgrave. Thanks so much for joining us. You may remember a terrible attack on the UC Merced campus back in 2015. It ended with 4 people being stabbed. One of them ended up needing bariatric surgery, but it wasn't to lose weight, it was to save her life. November 4th, 2015, a seemingly regular workday for Danielle Quiroga until it wasn't.
Didn't really see anyone until I saw him, and it sounds strange when I say that, but it's kind of one of those blurs.
Danielle is one of 4 victims stabbed by a man on the UC Merced campus that day.
He came towards me and I started running backwards towards a door, trying to get in the door, and he stabbed me twice, once in the front and once in the back.
Doctors say the weapon punctured her chest cavity. She went back to her hometown near Bakersfield to continue recovery, or so she thought.
It wasn't until about 4 weeks later that I started to really feel the symptoms.
They'd missed something.
So my diaphragm was nicked by one of the stab wounds to my back. We didn't see it on any chest x-rays, which is why it was kind of overlooked.
The chief of surgery there called me up and said, well, we have this patient who has a very unfortunate situation.
Dr. Kelvin Higa is the director of the bariatric program at Fresno Heart Surgical Hospital. He explains why those doctors chose the path they did for Danielle.
Part of her stomach had died, and so they actually resected part of the stomach, and this essentially led to one of the operations we did today, which is called a sleeve gastrectomy.
That surgery typically treats things like weight gain and diabetes.
Which is one of our standard operations, but not under these circumstances.
Doctors in Bakersfield removed 85% of her stomach. Still, more complications would follow. Danielle had a leak where the esophagus meets the stomach. To fix that problem, she didn't have to look far. Dr. Higa and his team in Fresno is considered one of the best, not just in California, the world.
Anytime we can help a patient through any disorder, this is why we became physicians. That's why we're in healthcare.
They performed an endoscopy, put in a stent, and today,
it's good to see you.
Danielle says she feels better than ever, even tackling hikes in Yosemite.
I'm doing really well.
Making what happened on campus that day in 2015 a distant memory. Danielle continued her physical therapy and rehab at Clovis Community Medical Center, but has since been cleared and back to life as normal. She's still working at UC Merced. Turning now to a topic many parents may worry about, teenagers and their mental health. Community recently helped launch the Fresno County Suicide Prevention Collaborative as a way to increase awareness about who to turn to when teens need help. This week, we're also talking to Dr. Sarah Stender with the Department of Pediatrics at Community Regional Medical Center in partnership with UCSF Fresno about what parents should watch for to keep their teens safe. Dr. Sarah Stender, thank you so much for joining us here today.
It's a joy to be here.
You are working through UCSF Fresno, and you are the only person who is doing what you're doing. What is that?
Well, I'm the only sub-board certified adolescent medicine specialist in the Valley now.
And you really have a focus on teens, and today we're going to be talking about mental illness. What is the scope of mental illness that you're seeing right now?
It is profoundly wide. It affects all socioeconomic classes. Of immigrants, newly naturalized children, and some who are very fearful because their families are not naturalized. Many of our children have been through lots of trauma in the process of getting here. There's a great deal of poverty in the patients that we see in this particular clinic.
What are some warning signs that people should look out for?
Basically a marked change in the behavior of the child. If the child who's normally been coming to the meal table and being happy, and then all of a sudden becomes extremely withdrawn. Now I say all of a sudden because it's sort of a normal developmental process for a teen to start becoming more interested in their friends, their peers, listening more to the peers than to the family, and wanting to break away a little bit and become independent. But what I mean is a marked change. Often this is accompanied by mood change, and a lot of times the youngster is either sleeping too much or not sleeping enough, eating too much, not eating enough. These are things that we call vegetative signs of depression. So that's the hard part for a parent. Do you say, well, this is just teenage behavior, or is this something that's really a problem?
So parents should really just be connected to their child. What should they do if they start noticing those signs?
Well, first I want to say connection is the key word. Parents need to remember that they're not their teen's buddy, that it's their job to be the parent and not to try to please the child or be afraid of being. I've heard parents say, I don't want to get in trouble with my child, and I kind of sit back and I say, wait a minute now, who's the parent here? Have a family meal together. I've had families who've looked at me like, what is she talking about, a family meal? Because they don't even know what the family dinner table is. We're so connected to media, so connected to our activities. That's another thing, don't overschedule your child so much that the child doesn't have room to grow and to develop mentally.
All good advice, Dr. Stender. Thank you so much. We sure do appreciate your time.
Thank you for asking me to come.
If you know a teen who might need help, the hotline is open now. Text HELLO to 741-741. It's free and open 24/7. Coming up on Medwatch today, she's already been named Laboratorian of the Year, and now this lab scientist earns another honor, Healthcare Hero. Hear her story. Plus, a new way to get the flu vaccine is on the horizon, and it could mean no trip to the doctor. Health headlines after this.